I took my kids to swimming lesson. Then I was coming from there, I was driving. We were coming home with my kids. Then all of a sudden I had this bad headache. I mean, really bad. I mean, usually, I mean, as I said, I have migraines and headaches, but this time it was very bad. I mean, it was like a knife stabbing my head. It was really bad. So I start feeling really weak, dizzy. I feel like vomiting. I knew it was different. It was, you know, it was not like the headache before. So I took some Tylenol just in case if that can help. Then it didn't. So I tried to call my husband, and my husband wasn't answering the phone. So my middle daughter told me to call 911.
An AVM, which is really an acronym for an arteriovenous malformation, it's an abnormal communication between the arteries and the veins without brain tissue in between. And the problem with that is when there's high pressure blood from an artery going into a vein, there's a risk of bleeding. In a patient who has an AVM, in fact, most of them won't have symptoms. But if they do have symptoms or problems, such as from bleeding, they can be catastrophic. And throughout the United States, I'd say there's estimated 300,000 people that have an AVM. Of these, probably 10%, 15% will have symptoms or problems with it. Now, what those can be, like I said, are bleeding, or the AVM can steal blood away from the rest of the brain that really needs it. And the types of issues that we deal with here are to try and prevent rebleeding or prevent bleeding in the first place. They're about 1/6 as common as aneurysms, and they affect all races, and they affect men and women about equally. Detecting AVMs by imaging often occurs with either a CT scan of the head or MRI. Many times a patient shows up in our emergency room for difficulties such as headache, stroke-like symptoms, and a CAT scan is the first thing they'll get. Many times it will show nothing if it's a small AVM, or if the person has had a bleed, we'll see the hemorrhage. In between, we can see findings of an AVM such as a suggestion of a dilated vascular structure like a vein, or occasionally calcification. A more definitive test is MRI, because that tells exactly, is there a vessel there, or is it normal brain, or is there a tumor?
So when they did this CAT scan, they find out I was bleeding in the head. I thought life is over. I start crying and shaking, and you know, I start thinking about my kids and my husband and my family.
Brain arteriovenous malformations are complex vascular structures which are like an abnormal tangle of blood vessels inside the brain that have a tendency to burst and cause a bleeding type stroke. There are various ways we can treat them. One of the ways is to do open brain surgery and remove this abnormal tangle. We can do this in the brain suite, which has MR guidance, and this assists the neurosurgeon in removing this abnormal tangle of blood vessels. We can also burn it down with radiotherapy, which is like radiation to burn down this tangle of blood vessels. And we can also do minimally invasive techniques using catheter-based techniques to treat these tangle of blood vessels. These catheter-based techniques that we use are called endovascular embolization techniques, and in simple words, we use either super glue or a lava-like substance called onyx, and we go in and we inject this liquid substance and we shut down these abnormal tangle of blood vessels. Once we shut down these blood vessels, they don't burst, and it decreases the risk of having any further problems from these tangle of blood vessels.
It's like a second chance. I mean, real bad migraine and headache, all the time. I mean, sometimes I have to take Tylenol like 3 times, 4 times a day. But now I'm like, I don't even have a headache. Tomorrow is like, I look forward to see tomorrow. I mean, I'm very grateful.